Hello, I'm Jack, and I'm with Brock Delfante at the Medicines Management 2015. And Brock is from Sir Charles Gardiner Hospital in Western Australia. And Brock's got a poster. Would you like to tell us a bit about the background of the poster?
Yeah, so my poster is called Comparison of Medicine Supply in Western Australian Public Hospitals, Is There a Better Way? And essentially what the poster was aiming to do, and this research, the preliminary findings found that there was variation in hospital processes, and there was a lot of anecdotal evidence to suggest that that was the case, but there wasn't really any findings or anything published to really, I guess, look at what what the variation was and what the result of the variation was. So in my research, I went to 4 different public hospitals in WA and conducted some structured interviews to make some process maps of those hospital processes. Then I looked at activity from those hospitals, and when I say activity, what I mean is dispensing activity, the cost of medicines that they were supplying to inpatients, the PBS reimbursement for those cost of medicines, to see what the differences were, and the differences were quite significant.
What were the hospitals that you collected data from?
So the hospitals were actually de-identified in the process,
right,
because there were quite significant differences, but I guess we're still at a stage where we don't know what that means. So at this point, we're trying to identify what might be inefficiencies and what might be efficiencies, and to go through the efficiencies and put them together into an optimal system that we could maybe standardise across the state. So at this point, it's a bit of a closed discussion between those hospitals, but eventually those findings will be made public when we develop that system. And
we've certainly got some preliminary information on the poster that's in the hall today.
Yeah, definitely. Yeah, some quite good results which showed that for medicine supplied to inpatients in the hospital per patient per day, there was up to 55% difference between the number of medicines that we were supplying. So obviously there are some confounding factors such as patient acuity between those hospitals, but whether or not that was causing the total amount of variation or whether inefficiencies was playing a part, we still don't know yet.
Yep. What number poster is it?
Number 59.
Number 59.
Yeah.
And have you done it solo, or other people helped out with it?
No, definitely a team effort. So my PhD supervisors were very involved, including supervisors from Sir Charles Gardiner Hospital and the University of Western Australia.
Do you want to shout them out while you've got an audience?
Yeah, I'd love to. So Peter Smart is the Deputy Head of Department and one of my supervisors from Sir Charles Gardiner Hospital, and Rhonda Clifford and Lisa Subert, both professors at UWA.
Terrific. Anything on the program that you're keen to see in the next couple of days?
Keen to see. Well, I've already seen quite a lot. That's been great. The leadership boot camp on Thursday, probably the highlight so far.
Cool. Excellent. So lots more to come.
Yeah, definitely.
So there are 2 poster screenings, Saturday afternoon and Sunday, but they're open access all the time. Thanks a lot, Brock.
Thanks, Jack.
Thank you.
Bye.